I've got a PowerPoint presentation, but before I bore you all to death with that, I think what Alicia has just explained is what was behind our thinking for the specialist support service that we came about at Tommy's. This, like Alicia coming along to Tommy's and saying, I'm going to do Black Baby Loss Awareness Week. And we all went, how's this not already exist? And why is this only just happening in 2023? And like, why hasn't this already existed? And why don't we know about this? That was kind of the energy that she has brought to our team. And we are incredibly privileged and lucky to have her as part of our team at Tommy's. The specialist support service that we started at Tommy's came from very similar thinking. I think everybody here and, everybody, I hope, are aware of the inequity in maternal outcomes, but also in baby loss that women from Black or Black mixed heritage backgrounds and birthing people from those backgrounds face. And we had got to a point where as a team, we were aware of it and we were discussing it. And then it gets to a point where you go, we know. I've been a midwife for 18 years. I've read the Embrace report for those 18 years, and I have seen those statistics for 18 years. This was not new information. This was not something that suddenly happened during COVID. This was not something that has come out of the blue. But for too long, it felt like everybody was saying, oh, it's terrible, but not much was happening with it. Now, we're a small team. We're not the huge, wonderful cog that is NHS and this great machine that when it works beautifully, but sometimes it doesn't. But we're a small team, but we knew we were passionate about doing something. And like Alicia said, we were frightened of doing the wrong thing. We didn't want to take missteps in that. And sometimes that kind of fear paralyzes you, and you kind of go, no, somebody else should do that. It's a really good idea for somebody else to do. We were very, very lucky that we were working with amazing organizations like 5 Times More, who are the best friends you need when you are setting up a service like we were doing, because they would push us and they would prod us and they would ask us the questions that we'd have to go, oh yeah, okay, let me go and think that one again. And they would hold us to account and would constantly, and again, a bit like Alicia, I don't know where the energy comes from, but constantly advocate on behalf of Black women and women from Black mixed heritage backgrounds about having a service that was true, that was rooted in wanting to address equity and not something that was tokenism. So it felt big. It felt very big. I'm not a Black woman. I come from South Asian heritage. I'm a Muslim woman. I've, like Alicia, I'm a bereaved parent. And unlike Alicia, I didn't have great care, which impacted my kind of journey, kind of going forward. And I came about working in this space almost slightly accidentally, because I wasn't going to deal with grief, because grief was terrible and I didn't really want to deal with it, and I was going to put it in a box, like you say, and leave it, and I was going to be a midwife. And then suddenly it just catches up with you and you kind of go, oh, okay, so this is what I'm doing now, and this is what I talk about a lot. So that was kind of the thinking behind what the support service. So we had Tommy's has been running a support service for a while. Tommy's, I should put my presentation up. Bear with me a second whilst I attempt to do that. It may all go horribly wrong. So I hope you can all see on the screen. You can see that? Fantastic. And what am I trying to do here? Okay, brilliant. So this is just kind of giving you, I'll whiz through this. So Tommy's a charity, in case people don't know about it, exists to prevent the avoidable tragedy of baby loss. So since 1992, Tommy's have established 4 research centres across the UK dedicated to preventing miscarriage, preterm births and stillbirth. And what we do is we translate this research directly into clinical setting through our specialist on-site clinics, which provide state-of-the-art care and treatment to people who kind of need to access it. It's amazing when it works. I have worked at Tommy's for coming up to 7 years, and it's it's that part of midwifery which kind of, holds a very special place in my heart, where I get to have a phone call with someone, and right at the darkest moment, I'm able to just sometimes be that little chink of light to say there is hope for you. Like Alicia said, it doesn't have to end like this for you. This doesn't have to be where your pregnancy or your parenting journey ends, and being able to do that has been a real privilege. So under the care of our centres, outcomes for the people with complicated or more complex pregnancies are significantly improved. For example, we can report a 21% reduction in preterm births at St Thomas's Hospital in 2018 alone, against a UK and international trend of increasing premature birth rates. Since 2010, we've decreased the average stillbirth rate in the Manchester region by 32%, although currently in the UK, every year 60,000 babies are born prematurely. So even with the very best care and support in specialist hospitals, sadly many preterm babies do not survive into childhood, as Alicia has said, and for those that do, many more will be met with a lifetime of health challenges. And heartbreakingly, I think everyone is sadly aware that 3,000 families each year in the UK face the devastation of a stillborn baby. It's something that most people know about. It's kind of a universal Me Too moment, that if you haven't been affected by baby loss, you'll know somebody who's been affected by baby loss. And that is one of those truths that we hope didn't exist. Now, there's a lovely, very complicated graph on the screen there, which explains what we do with our research and how we do, how we work on it, and how equity is at the heart of everything that we are doing. And research informs and leads onto evidence-based guidance, and we hope to impact, for example, NICE guidance. So we did a piece of research into supporting people who are experiencing recurrent miscarriage, that then led to the PRISM trial, that then led to NICE guidance on supporting people who were bleeding in pregnancy, who had already experienced miscarriage. And as Alicia and I will tell you, it's something that we hear again and again from people, that they've come to Tommy. So it's great to be able to kind of see that evidence in practice as well. But I realise that I haven't got much time, so I'll move on to kind of talking about the specialist support service. So Tommy's have always operated a helpline service that offers advice and support on any aspect of the pregnancy journey. However, what we did realise was that not everyone was aware of us, and that we knew we weren't reaching those most affected by adverse outcomes in maternal health. Black women, women from Black mixed heritage backgrounds, women from South Asian backgrounds, women who didn't feel like Tommy's was necessarily a place for them. And it's something that I was very passionate about. The team that I work with were incredibly passionate about addressing that. But like I say, what can we do? How can we support people? So in order to address this and ensure that the services we offer, the expertise that we have in our team of 12 specialist midwives with a range of expertise that covers the whole pregnancy journey, and each of us have our unique experience of working in the NHS, was being accessed by everyone. We set up the specialist support service specifically for women from women and birthing people from Black and Black mixed heritage groups. Like I say, we questioned ourselves a lot. We asked for a lot of input. We had amazing input from people on what we should be doing, how we should be doing it, what would work and what wouldn't work. And then we kind of took a big deep breath and started a service. And actually the take-up has been amazing. I heard Alicia say at one of the many parliamentary events that she's been at this week, saying we're not hard to reach, and absolutely. It's that maybe we weren't trying hard enough, we weren't looking in the right places, we weren't asking the right questions. In the 4-month period since we launched the service, so it's been going on a little bit longer than that, we had within a 4-month period 104 requests for one-to-one callbacks. We managed to do 94 of those one-to-one contacts with people, and most of our calls last about 60 to 90 minutes long. And we offer a range of either on the phone, we can do it over Zoom, whatever kind of works best for people. And you can see the feedback there on the screen about what people kind of found with it. As somebody who kind of initially was taking the majority of those calls as our team was kind of waiting to be expanded, that was what was kind of amazing from my viewpoint as a midwife, speaking to people and just people saying it's good to be listened to. It's, you know, it's often the first time I feel like I can talk about this. If I give you an example, I was working on the specialist support service today, and I had a call with somebody who had called twice earlier, so this was her third call back with us, and I was checking in with her because I knew she had a scan, and we'd agreed that we were going to do that, and I called her back and she said, you know, she told me heartbreakingly that sadly she'd had a miscarriage. We talked about what had happened, and then I said, can I help, or, you know, do you need another week or two, what do you need? And she said, well, you know, when can I try again, because I don't know, because nobody's told me, and what does it mean, and, you know, what can I ask for? What am I allowed to ask for from my GP? What am I allowed to do now? And I just saw that face you made, Sue, and that's exactly how I felt as well. Women questioning their bodies, women questioning their ability to make these decisions that they shouldn't have to, because sadly, the care that they've received isn't necessarily not compassionate, but there isn't someone there to really delve into. There's not that curiosity you need of, have I answered all of your questions? Are you leaving this clinic right now with all of those questions that you need answered, or are you going away and you're going to go home and sit there and think, can I try again? Should I try again? Is it safe? Isn't it? And you don't know who to ask those questions of. And we had a lovely long conversation. We talked about the different pathways. I don't have the answer. I don't believe it is my role to tell people what to do, but here are all of the kind of varieties of pathways that you could explore, what exact words to ask when speaking to your GP if you want to ask for certain blood tests. This is the name of the blood test, this is what it does, this is how you ask your GP for it. That means so much. You know, when she ended the call, she was, thank you so much, I kind of feel like I can breathe, which was lovely to kind of hear somebody who'd been holding their breath since she'd had her miscarriage last week being able to do that. And that's what the specialist support service is. It's, you know, I keep saying to people, it's not rocket science, it's talking to people, it's listening to people, it's being curious to get beyond just, are you okay? And ending that phone call to say, do you have any further questions? Is there anything more that I can help you with? Being able to offer that service to people who have faced the greatest inequity in maternal outcomes, who face 2 times higher increased risk of a stillbirth and pregnancy loss, women and birthing people who often feel like they can't ask these questions because there's so many biases working against them, is so heartening and powerful to us as midwives who have been able to offer this service as well. I have learned more in the 6 months than I have learned in many, many years of midwifery. And when I go into my NHS role, my appointments are now off the scale, and I run at least an hour behind on everything because I keep asking questions. I keep saying, is there anything else? And then often, you know, I was talking to a friend the other day and I was like, they were literally they had the door and the handle about to leave the room. And I said, are you sure you don't have any further questions? They sat back down again. We had another half an hour conversation. But gosh, you know, at a time, I think, Sue, you mentioned earlier about, you know, it's a hard time to be a midwife, and it's, I leave with a spring in my step because I've done what I trained to be a midwife for. That's what being with women is about. And it feels amazing to be able to do that. And I wish I could do that for every single midwife out there as well, that you make a change and somebody has left feeling safe, feeling held in that way. So that's kind of our specialist support service. You can see from the feedback, we've had amazing feedback. 90% found it very useful, 93% felt very well supported, and 100% would recommend it. if I got very quickly to kind of take you through a case study of somebody who contacted us quite early on in that service. This was somebody who had previously had a premature birth at 32 weeks, who'd gone into labour at home because each time she'd rang her maternity unit, she was told that she wasn't really in labour. She ended up having her baby by herself at home. It was an incredibly traumatic experience. Didn't get the follow-up care that she should have, was navigating it herself, was incredibly well informed, had done as much reading, as I think your kind of pediatric consultants would be doing on risk of premature birth, and that wasn't her field at all. Had become pregnant again, had a miscarriage at 8 weeks. So we're talking about grief on grief, trauma on trauma. Was pregnant for the third time, 13 weeks pregnant, had called our service and was worried about another premature baby or a late miscarriage because she just felt like she couldn't trust the service because she was not being listened to. And each time she said, I'm worried, was being told, oh, well, we'll get round to that. You'll see someone, you'll get the care, and, don't worry about it, and it won't happen again. And like Alicia said, sometimes we say that from a point of kindness because we're trying to reassure, but it's not reassuring at all. I need you to hear what I'm saying. I need you to hear I am petrified, and I want you to tell me that you understand why that is, and giving me the care that I want, instead of minimizing it and telling me it's not that important. So she called, we had a very long conversation. We talked about lots of different things, and then with her permission was able to contact the preterm birth clinic that Tommy supports, discussed her concerns with the preterm birth clinic specialist midwife there, explaining that she would like a second opinion. The clinic kindly arranged for her to be seen in person 2 days later, and she had a care pathway. So when I called her back 2 days later, this was the email that she sent. She'd come back from a scan appointment. She had a list of appointments that she knew where she was going, why they were happening, what they meant, if anything happened in between that, where she should go, what she should ask for. And that's what made the biggest point of difference to her. A lovely ending to that story is I spoke to her a week ago, and she's had her baby, and she is thoroughly enjoying her postnatal period. And those of us who've been midwives for a little bit longer than we care to share will know that it's hard sometimes to come across that lovely kind of joined up feeling, but God, isn't it amazing? It kind of, it's the endorphin rush you get from just hearing somebody who's come through and said, actually, I'm sat here with my baby, I'm enjoying breastfeeding. And it was because I felt safe kind of doing in that. It was a team effort and it was collaborative working, but again, just some of that kind of curiosity to be able to do that. We've learned lots from the 4-month pilot project. We initially thought people would want to talk to us just about pregnancy loss because that's what we're known about. But actually, we people have been calling us about a whole range of things. Sometimes I'm pregnant and I don't know what to do. I think one of the saddest things that I keep hearing again and again is hearing from Black women, women from mixed Black heritage saying, I know that I'm 4 times more likely or 3 times more likely. I'm scared, I'm frightened. And I think that's something that so needs to be explored. How many women are coming into this journey petrified, knowing the statistics, because they are out there and they're scrabbling, they're trying to find a way of feeling safe, and they're doing all of the hard work, and us as maternity services, as midwives, as doctors need to step up to that. Lots of women really appreciated being acknowledged and understood, not being minimized, not being told, well, no, of course your midwife's not going to be biased again. Of course that's not going to happen, of course. And actually being able to, again, as NHS midwives as we are, as well as being Tommy's midwives, being able to say, I know what services look like at the moment. Let's find a way for you to feel safe and what works for you. And often I found that actually people know the answers themselves, but they just kind of want to do that. When we started promoting the service, we have found that we're getting between 1 to 2,000 unique visits to our booking page a day, which is amazing. So again, that idea that people are hard to reach, and people won't come to us because we're not the right thing. If you call it what it is, and if you say we're here, we want to help, people will come to you. And again, it's wonderful to kind of see that happening in practice as well. Next steps kind of going forward, it's kind of all the boring stuff that we all talk about. This was an initial project that was funded by the Tampon Tax Project, which the funding ended for. Tommy's is committed to continuing the service and have actually expanded our team to be able to do that. We're always looking for additional funding and sponsorship. We're hoping to develop a much more better booking system and actually expand more than just being a service that will kind of, say I'll signpost you onto it. I recently was at an event where I heard the term no wrong door, which I think was really, really powerful, where we can't keep saying to people, go and try and speak to this person and then leave them there. We need to keep going back and saying, did you actually get to walk through that door? And if you didn't, let's find you another door to do. And I think that's the next step, definitely, as somebody who manages that service to do, which, from a Tommy's perspective, would be supporting referrals to our research clinics to make sure that women from much more diverse backgrounds are accessing the amazing specialist care we have in our research clinics, which will also then increase the representation we have in research, because our data doesn't have that diversity that we would like it to have. So that's the end of my PowerPoint presentation. I'm going to try and stop sharing the screen and hopefully not break everything, which is great to be able to do. But I hope that's kind of explained it a little bit in a nutshell what we do. Please come to Tommy's website, have a look at it. Midwives, healthcare professionals, tell people we're there. We're not trying to replace NHS services, and we're very clear in that we are there to support NHS services. We're there to be that person you can go to because you didn't feel at that point you could ask a question, or you didn't know how to ask that question. So come to us. We've got the time, we've got the privilege of time to be able to give you as long as you need for us to have on that phone call. I am so lucky to be part of the Tommy's family and an excellent team that are compassionate, that are person-centered. At the heart of what we do are the people that we want to do, and incredibly curious to kind of go, I don't know the answer, but let me go away and find out something. And Alicia will tell you our WhatsApp group often asks very random questions. I think the highlight was in the middle of lockdown, somebody asking questions about whether orgasms could cause contractions at 9 a.m. in the morning. And we were all debating that, kind of going, oh, do you think so? Let's have a think about it. And kind of going, who knew? So we're very, very curious. But, if we don't know the answer, we'll find somebody who does.